Developers and innovators are pushing at an open door. And certainly the NHS, under huge pressure, I mean, it has to save something like £22 billion. You just simply can't do that by buying toilet rolls cheaper and turning the lights out. You have to radically reappraise how services are delivered to patients, and technology will play a huge part in that. In the last 10 years, average bed stays have halved. And that's by and large down to better medical devices and medical technology that keep people in hospital for a shorter period. What we're seeing now is the emergence on mobile phones of dial-a-doc services. There's one called Babylon. There's a whole range of services now where people are getting electronic consultations. Now, it's app technology that's connecting patients, particularly with long-term conditions where they create their own communities. I mean, Facebook, actually, if you're on Facebook and look under diabetes, there are a lot of diabetes communities which help patients. NHS staff respond very well to the idea of learning online. I mean, it's almost really, there's a huge amount of technology in their lives at home, but when they come to work in the NHS, it's like stepping back into the 1960s. If you take, for example, specialist nurses, there's a fantastic portal called Apollo for specialist nurses, which is hugely popular and has a huge amount of resource. A lot of hospitals are using that. I think, as a younger cadre of doctors comes through, they're more used to the idea of using social media and those sort of arm's length technologies, we'll see a big change. That will take a huge amount of pressure off the shoulders of the day-to-day NHS. And there are simple things as well, like, for example, outpatient appointments. Post-operatively, you always end up going back to the hospital for, how you're doing and all the rest of it. All of that can be done on FaceTime, it can be done on Skype. Patients will get faster access, they'll have a much better opportunity to speak to senior people quicker. So I think that there are huge benefits for patients and for the health service. The NHS has been capturing data since 1948. So the analysis of that, once you do that, you can find out why people have been ill, what did it cost, and do we want to do it again? Those sort of fundamentally basic business questions. So there's a huge untapped benefit, and it's a colossal amount of money that the NHS could save